Hello Vishal, my name is Pratiksha and I am the FNP student for United States University. The purpose of today's interview is a part of my assignment. This interview will be posted on YouTube. Just wondering if you are okay with it, and if you are okay, can I get a verbal consent from you for me to post that video on the YouTube?
Yes, I'm okay with it.
Okay, before starting the interview, let's me scan the whole room, which is also a part of this assignment. Okay, what brought you in today?
I'm here for my annual checkup.
Okay, can you introduce yourself to me, please?
My name is Vishal Chan. I was born August 29th, 1990.
Your age?
I'm 33.
Okay, your race?
I'm Asian.
How do you identify your gender as?
Male.
Okay, and you said your ethnicity?
Is Asian, Indian.
Okay, did you drive to the clinic by yourself today, or did somebody accompany you?
I came and drove by myself.
Okay, you drove by yourself. Perfect. So you said you are here for your annual checkup.
Yes.
Okay, other than the annual checkup, is there anything else we are talking about, like anything bothering you, any other health history?
I'm a little concerned about my weight. I feel like I've gained a lot of weight over the last few months.
Okay, when was your last doctor visit before this?
It was last September.
Okay, so since last September you have not seen any other doctor?
Correct.
Okay. So can you describe me about your medical history?
Medical history, I have torn my ACL on my right knee.
Mm-hmm.
And
Any surgical history?
yeah, surgical. I did have surgery on my right knee.
Mm-hmm.
And then
Do you know which month?
this was back in March of 2021.
Okay. And you'd say you went through a surgical procedure.
Yes, but I'm fine now.
Okay. During your surgery, did you have any complications on the surgery? Any problem with anesthesia? Anything? Do you remember happening? Anything?
No, everything went well.
Okay. Are you allergic to any of the medication you are aware of?
I am not allergic to any medication.
Okay. So, what is your marital status?
I am married.
Okay. Do you do you drink alcohol, tobacco use, anything?
I do smoke vape occasionally, and I do drink occasionally.
Okay. How often do you drink?
Maybe once a week, and then smoking probably twice a week.
Okay. How much do you drink?
Drink maybe 1 or 2 beers out of the week.
How many ounces do you think a can of beer has? Like, just is that the can of beer?
Sometimes a bottle, so I'd say probably maybe 12 ounces.
12 ounces. Okay, so you said 1 to 2 a week.
Yes.
Okay, and how many, how often is it? Twice a week you vape, or twice a day?
Yes.
Okay. Any caffeine intake? Do you drink coffee or any energy drinks? Anything do you drink?
I don't drink coffee, but I do drink energy drinks. I probably drink energy drinks once a day.
Once a day, okay.
7 days out of the week.
Okay. Other than your weight gain, any other past medical history, anything else?
That's about it for my medical history. It's just me gaining weight now.
Mm-hmm.
My knees, no issue now because I had surgery 2 years ago.
Mm-hmm.
But just the weight gain, I think maybe because I'm drinking too much energy drinks and not working out enough.
Okay, so what do you do for a living?
I work from home. I have my own toy business from home.
Okay, so basically you just sit all day long and just be in your chair, or how does that work? Can you just elaborate a little bit
Yes,
more
I'm
about
usually
your
just
history?
most of the time I'm on my computer
Uh-huh.
and I keep track of orders and sending out shipment and packaging toys that are ordered from my website.
Okay, so basically just sitting in the home, like
Yeah.
so do you exercise? How often do you exercise if you do?
I try to exercise. The best I can do is maybe once or twice a week. I don't get to go all the time because I'm so busy with my two sons. But when I do go work out, I probably work out for an hour at the gym. Usually play basketball for 30 minutes and then I go lift weights. But I feel like that's not enough for me to lose weight because I feel like it cancels out every time I eat because sometimes I don't have time to cook. I order fast food and then maybe that's why I gain weight, and also drinking too much energy drinks maybe causes me to gain more weight.
Okay. Do you or your family, in any of your family, has the history of obesity, or like what does your family history looks like? That's both on your mother's side and your dad's side.
So on my father's side, there's there's a history of high blood pressure, and for my mother's side, there's a history of diabetes.
Okay.
And
do you have any idea regarding your grandparents from your mother's side, the history, and your?
I think my grandmother had diabetes, and my grandfather from my dad's side definitely had high blood pressure.
Okay, what about your mom's side?
Oh, my mom's side, my grandmother had diabetes.
Are they still alive?
No, they passed.
Okay, both grandfather and the grandmother passed.
Yes, they have both passed.
What about your dad's side? Are they still?
My dad's side, my grandmother is still alive, but my grandfather has passed.
Does your grandmother has any history, any medical problem going on?
My grandmother from my dad's side actually does have diabetes.
Okay. Do you have any brothers and sisters? Any siblings?
Yes, I have one brother and one sister, both younger than me.
Okay. Any history in them, like any medical conditions in them?
I think both of them just have issues, just as like me with high blood pressure. I think this might just run in our family. We're not officially diagnosed, or haven't been diagnosed with high blood pressure, but we have been known to have high blood pressure every time we go to a doctor to get checked up on.
Okay, so it means like so
we're not getting treated for it.
Oh, you're diagnosed but not getting treated for
Yes.
it. Sounds good. Okay, what is your marital status? Are you married?
Yes, I am married. I am married. I've been married for about 7 years.
Any kids?
Yeah, I have 2 kids. I have 2
Okay.
twins.
Oh, twins. Okay.
Yes.
Okay. Okay, we will do a brief head to toe examination today. So starting from the head, like anything on the head bothering you? Do you have a headache? Anything?
Recently I have been getting random headaches, but once I take Tylenol, it goes away. Sometimes I just feel it on the left side of my head. Maybe it's because of my wisdom tooth that needs to be pulled. Maybe that's what causes it. But other than that, not too much head pain. Just once in a while.
Okay.
Maybe it's a lack of water. Maybe I need to drink more water.
Okay, I saw you wear glasses. Like, do you have a vision problem?
Yes, I have pretty bad eyesight. So I've been wearing glasses since I was in 7th grade.
Okay, when was your last visual examination?
My last physical examination was about 6 months ago. I have an exam every year, so my next exam might be from another 6 months from now.
Okay. Do you have any problem with your ear? Any hearing deficit? Anything?
Hearing, I feel like my hearing has been getting pretty low. It's harder for me to hear now since I'm getting older. I've been told that I can't hear. But yeah, I feel like it's getting bad. I probably need to get a checkup. I haven't gotten checked up since I was a kid.
Okay.
So I feel like I should probably get a whole exam for my ear.
Okay. What about your nose, throat, and mouth? Like any?
Nose fine. Throat is also fine. I've never had any issues.
What about your teeth? Any cavities? Any tooth are bothering you? Any teeth are hurting you?
Yes, I have one wisdom teeth that needs to be pulled. That's been really bothering me. It does have a cavity, and right now I'm using club oil to treat it. Other than that, no other issues.
Have you reached out to the dentist for that, or?
I have reached out to the dentist. They said that they are booked, so I won't have an exam until for another 2 months.
Okay. Okay. Uh, any chest pain, anything having shortness of breath, hard time breathing, high blood pressure, dizziness, lightheadedness?
Yes, mostly all of that. I do have high blood pressure.
Mm-hmm.
Like I said, it does run in my family, so I'm
Mm-hmm.
a victim to it. And also, I do have chest pains occasionally. It's not too bad, but I feel like it's probably more gas because every time I eat something,
Mm-hmm.
it might be gas related, and my chest does hurt. This is my
Mm-hmm.
chest and my back.
Okay. So it's more like after eating.
Yes.
Okay. Any problem on your stomach, like your appetite wise?
Stomach. Uh,
Any bowel problem, constipation, diarrhea, anything?
I only get diarrhea when I eat something dairy or like drink like milk or have cheese. It
Mm-hmm.
really affects me, like pizza. Like I love pizza, but that definitely hurts me every time I eat it because I do have to go to the restroom frequently
Mm-hmm.
every time I eat dairy.
Okay. Any problem on your extremities, moving your hands, legs, like
Uh,
difficulty?
no, I'm okay with that now. But when I did have my ACL surgery, it was hard because I couldn't walk or run for uh, about 6 months.
Mm-hmm.
So it was a pretty long recovery time. I was on crutches for 3 months.
Mm-hmm.
But now I'm able to do everything fine. Just can't run as fast anymore. Still taking time to get back to my regular speed. Other than that, that's fine.
Okay. Mm, So since you said you have a family history of diabetes, have you ever tested your diabetes? Are you diabetic? How does that?
I have been tested and I was not diagnosed with diabetes.
So you were not diagnosed with
Yes.
diabetes, but with the weight gain and your eating habit, do you think you need to?
I should probably get it checked up. But it's been a while since the last time I got checked. It's been about 4 years
Mm-hmm.
since the last time I got that checked. But I think probably now I need to get that looked at. And also my blood pressure, my high blood pressure needs to get checked up on.
Okay. How does your sleeping looks like?
Sleeping, I usually sleep maybe 4 to 6 hours a night.
Uh-huh.
It's just due to it's hard for me to fall asleep.
Okay.
I feel like I have a minor condition of insomnia, but
Okay. Like, how do you usually fall asleep? Like, how long it will take? What does your sleep cycle, like, bed habit looks like? Bed routine? Do you have a routine time? Like, you go to the bed at that time, or any specific bed routine, or just
I
random?
usually try to go to bed around 11 p.m.
Mm-hmm.
And the only way I can fall asleep is either I'm really tired from like doing some sort of activity, or
Mm-hmm.
I'm watching something on my phone, or like watching a movie or video game or listening to music. Like I need some sort of sound or something to pull me.
Something to divert your mind to fall asleep.
Yes.
Okay, so once you fall asleep, do you fall asleep like throughout the night, or you get interrupted sleep in the middle of the night? How does that goes?
No, I wake up to any sound. I do not sleep through the night. If my sons make a noise or cry or something, if I hear something fall, I'll wake up immediately. So I don't.
So it's an interrupted sleep for the night.
Yes.
Okay, so what time do you usually get up?
I usually get up around 5 a.m. to 6 a.m. That's when my sons wake up in the morning. So I have to tend to them.
Mm-hmm.
So usually get up around that time and take them downstairs and cook them food, give them milk, and just hang out with them.
Okay, so it's just like basically from 11 o'clock at night till 5 in the morning.
Yes.
Do you feel like that is being good sleep, like good amount of sleep for you, or you are feeling tired, exhausted? Like, how does that, is that affecting your mental health? How do you feel that mental health wise?
I feel like I'm fine because sometimes when my sons take a nap during the day, then I'm able to take a nap.
Okay, so you do take one nap a day.
Yes, I'm able to take maybe 30 minutes, sometimes an hour, depending how long my sons take a nap for. That's how long I'll nap with them. So it's not too bad, but usually not too exhausted in the morning because again, I drink energy drinks, so that kind of helps me have more energy and more active.
Okay, so like nap a day, taking energy drink to keep you throughout the day, and then just sleeping around 11 at night and waking up. So pretty much like regular. Is that regular consistent for everyday routine? Is that what it?
Yes, this has been my routine for almost 2 years.
Okay. So like, did you take any supplements or anything to put you to the sleep or anything?
I have never taken any type of supplement or medication or anything like that to put me to sleep. It's usually just my phone or like music or something to distract me, kind of.
Mm-hmm.
And then like once I get bored or like I'll just fall asleep by myself.
Okay.
Just to sound and phone. Like it's usually my phone.
Got you. Okay. Do you take any other medication?
No. Well, sometimes I take Tylenol just for the headaches, like I said.
Just as needed.
Yeah.
So is Tylenol helping you good for your headache?
Yes, I think it's mainly because of my teeth that causes my head to hurt. So that's why I take Tylenol. That's like usually once a week.
Okay. So let's talk about your eating habits. Since you have a concern regarding your weight gain, how does your eating? How many meals a day you eat?
So surprisingly, I don't eat 3 meals a day. I usually eat 2. But when it is the 2 meals, it's pretty unhealthy.
Okay.
Because it's usually fast food. Because I'm a bad cook. And maybe I'm lazy too for not cooking. So I usually order out, like DoorDash.
So when you order, like, what kind of food do you order? Like,
it's usually like tacos, burritos, or like chicken sandwiches mainly.
Okay, so either deep fried or high salt.
Yes.
Okay.
Yeah, it's usually just fatty foods, which I need to stop doing that because it's definitely having an impact on my life. Because I've never been this big ever in my life. This is the biggest I've ever been in my life.
Okay, so when you think, like, when we talk about this is your biggest weight, and how you describe, like, how much were you before, and then how much do you think you gained now? Like, what was the weight difference then and now?
So in the past 7 years, I think I've gained 50 pounds. Because when I first got married, I was 200 pounds, and now I'm 250 pounds.
Okay, so it's like a 50-pound weight gain.
Yes, which is bad because I've never been like this ever in my life. I usually stayed around 200 to like 180 weight range, but I'm not active anymore, so I don't get to exercise as much as I want to. But maybe I could find some time later on trying to figure out a schedule.
Like, when you exercise, what kind of exercise do you do?
So for cardio, I usually play basketball for 30 minutes, 30 minutes to an hour, and then I'll go to the gym side and do weightlifting. So I'll bench press, squat, deadlift, curl to gain more muscle. I feel like I need to do more cardio other than just playing basketball. I think I need to run on a treadmill or ride a bike.
Okay, so how many minutes a week or how many minutes a day? Like, how often do you exercise?
So it's probably once or twice a week.
For how long?
For maybe 2 hours.
2 hours a day?
2 hours a day, yes.
Okay, so when you exercise, it will be 2 hours for once or twice a week.
Yes.
Okay. And I think we covered a lot of the things, mostly from head to toe. So based on the interview, based on your assessment, like there are some risks, especially depends on your family history. Like, everybody has, you said, obesity, diabetes, hypertension, all these 3 things run on your family. So you are definitely on the risk of diabetes, definitely on the risk of high blood pressure and the obesity, which can easily be managed. And like you mentioned, weight gain is one of the concern you are having today. So what we can do is, like, we can talk more about a diet change, like a healthy eating habits and exercise. Like, you can balance your diet, basically a balanced diet. Instead of ordering more food from outside, maybe we can just make something on the home, or even when ordering, just try to choose like the food which is healthier for you than just the fast foods?
Yeah, I would love to have some. Like, I'd love to know your opinion to know what route I should take to lose weight.
Okay, yeah, we can I can we can even refer you for the nutritional counseling or like a weight balance therapy counseling or something like you. But the first step will always be diet and exercise, where you can balance your diet, balance your exercise timing, like what you maybe, even if you are getting like a specific time for the exercise, you can choose the exercise which will like when you gonna sweat more or use more energy, like you get engaged more on those activities. Like engaging yourself in like those activities will help you to stay active, sweating, and lose some of the weight. Of definitely choosing a balanced diet will also help you. Like a healthy diet version will help you to lose the weight. Losing weight has been one of the major problem for all of the people these days. So definitely it's not gonna go drop off all of a sudden, but using or choosing those healthy lifestyle will definitely help you to lose weights.
Okay, and do you think I should work out more than 2 times a week?
I will say as much as you can. Yeah, depends on your time and availability, like how often you can do it since you work from home and your life is a sedentary lifestyle. I will say yes, but again depends how much you are available on. Maybe like you are available 30 minutes for your lunch, you can put a treadmill next to you and just run on over there. Or like end of the day or middle of sometimes whenever you got time, you can go out for a quick walk or run. So we can use those simple intervention as an exercise.
Okay, and then with the energy drink, what do you think should be the solution?
Cutting caffeine is definitely one of the solution. Like that will help you to maintain your healthy sleeping habits. So taking one energy drink might be become a normal for you, but if you don't like, if you can keep yourself awake the whole day, I will definitely say no energy drink. And then that will maybe help you to sleep early in the night and wake up early. So if you can just maintain that lifestyle, like when you go to your bed at bedtime, just make yourself a bedtime routine on time, you can cut off the energy drinks.
Okay, but I feel like the energy drink helps me have energy in the morning. I know it's bad for me, but
It will give you the energy.
it's because I don't drink coffee or anything else. I do drink. I mean, I know it's bad, but it does help. Is there like a different solution? Do you know?
We can like the energy, even on the energy drink there are different level or version where some of them has high caffeine and then low caffeine, so you can always go like try to cut off from high to low.
Okay, and you think sugar free is better than sugar, or?
Yeah, definitely better than sugar ones.
Okay.
Is there any other specific concerns you want to talk about today?
That was the fast food. I need to cut on the fast food, correct?
Yes.
Should I just cut it off completely out of my diet?
If you can, yes.
Okay, I feel like that's like a big issue too, because again, I need to stop being lazy because I usually tend on order from DoorDash. And it's not just for me, it's usually for my sons too. But I feel like it's bad for them too for eating too much fast food. So maybe I should do more grocery shopping and not door dashing as much.
Okay, we are almost at the end. If you don't have any questions, and I realize I forget to ask you, like, are you up to date with the vaccination? Do you need any vaccination today? Like, what about your flu? When was the last time you took your flu vaccine? Do you remember?
I did have my flu vaccine last year, but I feel like I need to get another one soon. And then I am up to date to my COVID vaccination, but I do think I need to get another dose of that also.
How many doses of COVID you got?
I have 2 doses of COVID, but this was last year, I believe. I believe last year with Pfizer.
Okay. Okay, then yeah, definitely we can update your immunization record and give you the ones you have not received.
Okay.
So plan for today will be giving you in one of those if you are interested in.
Okay. And would I have to take a TV?
No, you
TV.
don't have to,
Okay.
unless you want for anything.
Okay.
Okay. It was nice talking to you. If you don't have any questions, thank you so much for letting me to interview you.
Of course. Thank you.
Have a good day.
You too.